Chapter 23, Infectious Diseases of the Genitourinary System. First, we'll look at the urinary system, which is the system that releases waste from the body. So it's a tube that filters out blood, and urine flows from the human via the urethra. The reproductive systems are going to differ in male and female. So we have the male reproductive system on the left. The tissues that we're going to focus on for our infectious diseases are the urethra, which is the tube where urine flows out. The epididymis, which is the tube where sperm that's made by the testes flows to the urethra. And the prostate gland, which is the walnut-sized organ that's going to become infected in a couple of our diseases. On the right, we have the female reproductive system. So we're going to mostly focus on the vagina, the cervix, and the ovaries. So this is basically a long tube where the vagina is the most external, and then going up from there we have the cervix, the uterus, and then the ovaries and fallopian tube. So these are the tissues that will become infected with the two microbes we're discussing in this chapter. Okay, so defenses of this system. First, in the urinary tract for both genders, the main defense is going to be the flushing action of urine. So having a liquid released from the host makes it very difficult for microbes to enter via the urethra. There's also a very few attachment sites that microbes would be able to adhere to in this urinary tract. And then every time we urinate, we lose hundreds of thousands of epithelial cells. So this constant shedding of epithelial cells is yet another way to prevent microbes from adhering and getting established. We also will see secretion of immunoglobulin A because this is a mucous membrane lined system. And then urine will have lysozyme, which is the enzyme made in humans that will destroy peptidoglycan in the bacterial cell wall. And urine will also contain lactoferrin, which is going to sequester free iron. That's an essential nutrient for microbes. There are several types of normal biota in the urinary tract. Most of these are difficult to culture, but we can tell by genetic analysis that the DNA of these microbe groups are present, so they can be detected that way. Then looking at the genital tract, so first we'll discuss female. In childhood and post-menopause, we have mucus secretions and secretory immunoglobulin A antibody are the main defenses. The biota will be the same as the urinary tract. In a female, during childbearing years, the system changes significantly, where some of the cells in the genital tract will start releasing glycogen that is fermented by bacteria with an acidic byproduct, making the pH of the genital tract become acidic in childbearing years. And then additionally, we have mucus secretions and secretion of immunoglobulin A from the mucous membrane. The biota in the female during childbearing years will change significantly from childhood and postmenopause. It is going to be variable in individuals, but the main families are lactobacillus and the others listed here. The male genital tract is going to be the same as the urinary tract. There are some additional normal biota that are present in the male genital tract. All right, the first of the sexually transmitted diseases of the urinary system and genital system is Neisseria gonorrhea, which is a bacteria that causes the disease gonorrhea. So Neisseria gonorrhea is a gram-negative diplococcus. It's also referred to as gonococcus, and it only infects humans. So humans are the only reservoir of this bacteria on Earth. The estimated incidence of gonorrhea is 1 million cases per year, and many of these are going to be asymptomatic, which is why testing for gonorrhea is very important to ensure that it's not transmitted unknowingly. The mode of transmission is direct by sexual contact because its portals of entry are going to be the genitals, the anus. It can enter through eyes and respiratory system in babies, so it needs a mucous membrane to attach to in the host. Vertical transmission from mother to baby is also possible. As the baby passes through the birth canal, it can contract gonorrhea if the mother has an infection. Virulence factors are its ability to adhere to epithelial cells of the urethra or cervix in males or females. And it adheres to these very strongly with fimbriae. It also is able to do antigenic changes to its fimbriae where it can express them or alter them, and that will help the gonorrhea to evade host defenses. And it produces immunoglobulin A protease, which is an enzyme that will destroy immunoglobulin A, which is one of the main protections of the genital and urinary systems. The tissues infected, so in males we see the urethra infected. Often female urethra can be infected as well, which is the tube for urine. In males, the infection can move inward and also affect the prostate gland and the epididymis. In the female, we see the vagina infected, and the infection can move more inward to the cervix, the uterus, and even the fallopian tubes. In very rare cases, Neisseria gonorrhea can infect the blood and can travel throughout the body and get into the joints to cause arthritis. And in babies born of infected mothers, we can see the bacteria enter via the mucous membranes of the eye, the pharynx, and the respiratory tract. So signs and symptoms of gonorrhea are painful urination, yellowish discharge, and potential infertility in males, vaginal discharge containing mucus, pus, or blood, and pain in females, including pelvic inflammatory disease, which can lead to sterility in females, and very rarely arthritis, rash on the limbs, endocarditis, which is an infection of membranes surrounding the heart, and meningitis. Although in many cases, the infection by gonorrhea is asymptomatic, so people are carrying the bacteria without knowing it unless they've been tested. Diagnosis, we can do PCR tests of secretions to detect in gonorrhea DNA, so you're just looking for the genetic material of the bacteria. It is also possible to do a gram stain and look for the gram-negative diplococcus. Prevention, there is not currently a vaccine, so we only have treatment, treating with antibiotics, although gonorrhea is becoming resistant to many antibiotics that were previously used, so that is a very serious public health concern. And often individuals that test positive for gonorrhea will be treated for chlamydia as well, because co-infection with gonorrhea and chlamydia is very common. And then using barrier protection for sex can prevent the spread of gonorrhea. So these are the tissues infected. In the male, we see the urethra infected. We can also see the infection move to the prostate gland and the epididymis. In the female, we have the vaginal orifice or the vagina infected, the cervix, and the infection can move more inward to the ovaries and the fallopian tubes. Invasive gonorrhea in women, which is gonorrhea that moves beyond the vagina into the cervix, uterus, and fallopian tubes, can cause sterility. So in this figure from your book, we have what the structures look like normally on the left, and on the right we have what they look like in gonorrhea. So the whitish mass is an infection with Neisseria gonorrhea, which can block the fallopian tubes and lead to things like ectopic pregnancies, where the fetus starts developing outside of the uterus abnormally. And this will result in loss of the fetus and miscarry, and can prevent the female from becoming pregnant in future years. On the right, we have a gram stain of Neisseria gonorrhea, which is described as being shaped like a kidney bean, where the two bacteria in the diplococcus will lay together on the flat end of the kidney bean. The other cells in this stain are neutrophils of the immune system. Okay, the next and last disease we'll discuss in this chapter is chlamydia. So chlamydia is caused by a bacteria called Chlamydia trachomatis, which is a gram-negative, very small bacteria. It is an obligate intracellular parasite, so it has to get within the host and within host cells in order to reproduce. It is the most common reportable infectious disease in the United States, and the reportable infectious diseases are those that have been deemed a public health threat by the Centers for Disease Control or the World Health Organization. So if a physician encounters a reportable infectious disease, they have to report that disease to one of those agencies so they can gather statistics on it. Because chlamydia's occurrence is rising, it is required that physicians report cases of chlamydia. So it's estimated that there are 5 to 7 million new cases per year in the United States, and the majority of chlamydia infections are asymptomatic, similar to gonorrhea. It's transmitted directly by sexual contact or vertically from infected mother to newborn. It has an ability to grow intracellularly, which we'll look at a diagram of in a moment. It also can prevent formation of the phagolysosome in the phagocyte. So tissues infected in the male are the urethra and the epididymis. In the female, we have infection at the cervix. Rarely, it can infect lymphoid tissues, and in newborns, it can infect the eyes and the lungs when delivery through the birth canal occurs. Signs and symptoms are discharge, painful urination, inflamed epididymis in a male, and inflamed cervix in a female, pelvic inflammatory disease, and sterility in a female. So we can do either PCR to detect the DNA from Chlamydia trachomatis in a sample, or a test called ELISA, which will detect antigens from the bacteria. You can also try to culture the bacteria to confirm the PCR or ELISA test. And there is a urine test to look for antigens of Chlamydia trachomatis, but it is not completely reliable. So that's usually an accompanied test with one of the others. Prevention is to avoid contact with infected tissues by abstinence or barrier protection using condoms. It's recommended that everyone who is sexually active is screened annually for chlamydia. And if you are testing positive for chlamydia, you will have antibiotic treatment, and you'll often be rechecked in 3 to 4 months for reinfection, which is very common and also can contribute in chances of becoming sterile. So tissues infected in the male, we have the urethra and the epididymis, and in the female, we have the vagina and the cervix. The life cycle of Chlamydia trachomatis is very complex. So Chlamydia trachomatis exists in 2 stages, the elementary body and the reticulate body. So the bacteria alternates between these 2 forms. The elementary body is an infectious particle, but it is metabolically inactive. So although it can infect new host cells, it's not able to do metabolism and divide. The reticulate body is non-infectious, but it is actively dividing. So in this diagram from your book, we start at step 1, where we have a host cell, which is a human cell with the nucleus drawn. We have the Chlamydia trachomatis elementary bodies drawn as small blue circles. So the elementary bodies attach to the host cell and get ingested by the host cell. So within the host cell, they are now present in a phagosome. The enlarged view of the cycle in the phagosome is then shown with step 2, where the elementary body, once it's in the phagosome, it will convert to a reticulate body in step 2. And then the reticulate body, because it's actively dividing, can divide by binary fission in step 3. And in step 4, the reticulate bodies will develop and will alter back into elementary bodies in step 5, where they will then be released from the host cell, from the phagosome, and then from the host cell. And they will then go in step 6 to infect a new host cell. Once they get into that host cell, they'll switch to reticulate bodies, and the process will continue. Chlamydia also has a cell wall that prevents fusion of the phagosome with the lysosome inside a phagocyte. So this immune cell is unable to destroy chlamydia because it has this ability to block phagolysosome fusion within the phagocyte. So gonorrhea and chlamydia are the most common reported sexually transmitted infections, and infection rates are rising. In the age group of 15 to 24, infection is rising at the highest frequency. And so both of these are being watched by the Centers for Disease Control and the World Health Organization. And that concludes chapter 23.